Good morning. This is Mike Berkley. I'm going to be giving a little presentation today on IVF, intrauterine insemination, acupuncture, and herbal medicine. But first, a couple of other things I'd like to touch upon. Number one, I want to give a shout out and condolences to the family members of those who survived the loss of their loved ones 18 years ago on September 11th. I also want to give a shout out to the first responders who did an amazing job, some of whom risked their lives, many of whom lost their lives. And of course, I want to pay my ultimate respects to those who died during this tragic assault upon our nation and our city. Rest in peace. Now a little bit about my black eye. So I got it by accident in training, not in scrapping in the street. Just don't want you to get the wrong idea. So IUI and IVF are successful modalities of intervention for those who are faced with fertility challenges. However, they often, and in fact most often, fail, at least the first several times. Of course, there are people that do get pregnant with the first insemination, or they do get pregnant with the first in vitro fertilization, but it's rare. And sometimes you have cases where patients will get pregnant and then subsequently miscarry. Keep it in mind that there have been over 4 million live births which have occurred as a result of in vitro fertilization. But the real question to ask is how many transfers were done to yield 4 million live births? I don't know the answer, but I would put to you for your consideration many more transfers were executed than there were children born. So does this mean that I'm against intrauterine insemination or in vitro fertilization? Of course not. That would be ridiculous. What I am saying is that when a couple undergoes intrauterine insemination, the sperm is inserted through a tube into the uterus, close to the fallopian tube, and deposited, while at the same time the woman is made to ovulate, either with Clomid or letrozole, or perhaps even injectable gonadotropins. And maybe it works, maybe it doesn't. Why doesn't it work? Well, it may not work because the husband's sperm has poor morphology on the head of the sperm and it can't penetrate the egg. It may not work because the patient is a little older and the zona pellucida, which is the covering of the egg, is too durable to allow the sperm to penetrate the egg. Or perhaps the sperm does penetrate the egg and she gets pregnant and miscarries because it's an aneuploidic or chromosomally abnormal embryo. Let's talk about in vitro fertilization. So the patient is given gonadotropins to help develop follicles. Once the follicles are mature enough, they are retrieved, fertilized either in a petri dish or via ICSI, which is intracytoplasmic sperm injection, where the sperm is actually inserted into the egg. Now you have an embryo and it's transferred. Women may get pregnant and miscarry. Why? It could be implantation failure. It could be because the embryo is chromosomally abnormal. It could be because she has too many pro-inflammatory cytokines circulating in the uterine cavity. It could be there's too much testosterone in the ovaries, which is an anti-estrogen, causing a deleterious effect on the eggs. This happens typically in the polycystic ovarian syndrome. So there are many reasons why IVF and IUIs don't work. And of course, I'm always happy when they do. So the point of this whole monologue is to advise you and all the listeners to consider including acupuncture and herbal medicine in your reproductive medicine protocol. Why? Well, when you do an IUI or when an IVF is being done, it's strictly mechanical. Remember that. Medicine is given to facilitate the growth of multiple follicles in the IUI patient or the IVF patient. In the IVF patient, the eggs are retrieved, fertilized, and put back. It's a mechanical procedure. Same with IUI. Sperm is produced, it's inserted, and we hope and pray that a good sperm will penetrate a good egg, and the woman will become pregnant and give birth to a beautiful, healthy child. Often this is not the case. Why? Because you're dealing very frequently with older patients, meaning anybody over 34 years old, and they have two things that often occur, which are diminishment of ovarian reserve as well as compromisation of egg quality. Of course, with men, even over 38 years old, there is some degradation in sperm quality. And so what acupuncture and herbal medicine do is they improve the quality of your eggs and or improve the quality of your sperm and or improve the quality of the uterine lining, thus avoiding implantation failure. And so now we're not dealing with a mechanical method of intervention, but we're more dealing with a medical intervention through the use of acupuncture and herbal medicine. It's kind of ironic, isn't it, that the acupuncturist is actually doing more medicine in this case than is the reproductive endocrinologist, in a way. But regardless, and in spite of all of this dialogue about this versus that, the bottom line is that if you want to be a champion, world champion boxer or martial artist or opera singer or dancer, or you want to be, Michael Jackson or Michael Jordan, it takes lots and lots and lots of preparation to get to the point where there's a quality product that can become championship level. Well, so too is the case with eggs and sperm. They have to be brought to a championship level so that when an IUI or an IVF is done, it is now being done with very good sperm and very good egg and very good lining. And this, of course, completely improves the chances of successful outcomes. So I think that's all I have to say for today. If you'd like more information about this, visit my website, which is www.berkleycenter.com. That's BERKLEY center.com. You can also call 212-685-0985, and I invite you in for a free consultation. No obligation, no commitments. Let's just talk about your case and parse it through and see if there's anything that I think I can do for you and see if there's anything that you think that I can do for you. And if there is, we'll get together and do some good work. So I look forward to speaking with you, and more importantly, I look forward to meeting you. Godspeed on your journey to family, and it's been great. Take care until next time. All the best. Bye-bye.